was asked to, invited rather, to give this talk a couple of months ago, we discussed a number of titles with the organizers, and a lot of different titles were kicked around and were discussed, but nobody suggested this one. And the reason for that was 2 months ago, Ebola was escalating exponentially and spreading over wider geographic areas than we had ever seen. And the world was terrified, concerned, and alarmed by this disease in a way we've not seen in recent history. But today, I can stand here and I can talk to you about beating Ebola because of people whom you've never heard of. People like Peter Clements, a Liberian doctor who's working in Lofa County, a place that many of you have never heard of, probably, in Liberia. The reason that Lofa County is so important is because about 5 months ago, when it was the epidemic was just starting to escalate, Lofa County was right at the center, the epicenter of this epidemic. At that time, MSF and the treatment center there, they were seeing dozens of patients every single day. And these patients, these communities, were becoming more and more terrified as time went by with this disease and what it was doing to their families, to their communities, to their children, to their relatives. And so Peter Clemens was charged with driving that 12-hour long rough road from Monrovia, the capital, up to Lofa County to try and help bring control to the escalating epidemic there. And what Peter found when he arrived was the terror that I just mentioned to you. So he sat down with the local chiefs and he listened. And what he heard was heartbreaking. He heard about the devastation and the desperation of people affected by this disease. He heard the heartbreaking stories about not just the damage that Ebola did to people, but what it did to families and what it did to communities. And he listened to the chiefs, the local chiefs there, and what they told him, they said, when our children are sick, when our children are dying, we can't hold them at a time when we want to be closest to them. When our relatives die, we can't take care of them as our tradition demands. We're not allowed to wash the bodies, to bury them the way our communities and our rituals demand. And for this reason, they were deeply disturbed, deeply alarmed, and the entire epidemic was unraveling in front of them. People were turning on the healthcare workers who had come, the heroes who had come to try and help save and the community, to help work with the community, and they were unable to access them. And what happened then was Peter explained to the leaders. The leaders listened. They turned the tables. And Peter explained what Ebola was. He explained what the disease was. He explained what it did to their communities. And he explained that Ebola threatened everything that made us human. Ebola means you can't hold your children the way you would in this situation. You can't bury your dead the way that you would. You have to trust these people in these spacesuits to do that for you. And ladies and gentlemen, what happened then was rather extraordinary. The community, the health workers, Peter, they sat down together and they put together a new plan for controlling Ebola in that Lofa County. And the reason that this is such an important story, ladies and gentlemen, is because today, this county, which is right at the center of this epidemic, you've been watching, you've been seeing on the newspapers, you've been seeing on the television screens. Today, Lofa County is nearly 8 weeks without seeing a single case of Ebola. Now, this doesn't mean that the job is done, obviously. There's still a huge risk that there be additional cases there. But what it does teach us is that Ebola can't be beaten. That's the key thing. Even on the scale, even with the rapid kind of growth that we saw in this environment here, we now know Ebola can be beaten. When communities come together with healthcare workers, work together, that's when this disease can be stopped. But how did Ebola end up in Lofa County in the first place? Well, for that, we have to go back 12 months to the start of this epidemic. And as many of you know, this virus went undetected. It evaded detection for 3 or 4 months when it began. And And that's because this is not a disease of West Africa. It's a disease of Central Africa, half a continent away. People hadn't seen the disease before. Health workers hadn't seen the disease before. They didn't know what they were dealing with. And to make it even more complicated, the virus itself was causing a symptom, a type of presentation that wasn't classical of the disease. So people didn't even recognize the disease, people who knew Ebola. For that reason, it evaded detection for some time. But contrary to public belief sometimes these days, once the virus was detected, there was a rapid surge in of support. MSF rapidly set up an Ebola treatment center, as many of you know, in the area. The World Health Organization and the partners that it works with deployed eventually hundreds of people over the next 2 months to be able to help track the virus. The problem, ladies and gentlemen, is by then, this virus, well known now as Ebola, had spread too far. It had already outstripped what was one of the largest responses that had been mounted so far to an Ebola outbreak. By the middle of the year, not just Guinea, but now Sierra Leone and Liberia were also infected. And the virus was spreading geographically, the numbers were increasing. And at this time, not only were hundreds of people infected and dying of the disease, but as importantly, the frontline responders, the people who had gone to try and help, the people, the healthcare workers, the other responders were also sick and dying by the dozens. The presidents of these countries recognized the emergencies. They met right around that time. They agreed on common action, and they put together an emergency joint operations center in Conakry to try and work together to finish this disease and get it stopped, to implement the strategies we talked about. But what happened then was something we had never seen before with Ebola. What happened then was the virus, or someone sick with the virus, boarded an airplane, flew to another country, and for the first time, we saw in another distant country the virus pop up again. This time it was in Nigeria, in the teeming metropolis of Lagos, 21 million people. Now the virus was in that environment. And as you can anticipate, there was international alarm, international concern on a scale that we hadn't seen in recent years caused by a disease like this. The World Health Organization immediately called together an expert panel, looked at the situation,